we all know the theme of the presentation is silent noise. But what I'm going to present today is a technology which is not exactly a silent noise, but it's actually an explosion in a very positive sense, because it has affected a lot of patients in a very positive way. Just have a look at this video. See, the video looks quite hazy. It's all out of focus. Is my camera wrong? Something is happening. I can see things only when I go very close to the object of interest. Where actually this patient is a patient. This is a vision simulation of a patient who suffers from high myopia, and she's not using any glasses. So basically, I want to show this in order for you to experience how a life of a patient who gets up every day with a vision like this, and he's totally dependent on glasses and contact lenses to get the day going. So this is what they routinely suffer. They have vision, but it's actually not usable vision. So what you have, basically what's a high myopia is, we all know the basic optics. You know, the light comes on the eye. It doesn't hit the retina. It comes just in front of the retina in the form of a point focus. And you need a corrective lens in front of the eye to bring that point focus on the retina. Now, higher the degree of myopia, higher the degree of refractive error, you need a thicker lens. So it can be as thick as this. It's a pretty thick lens, isn't it? So this is what happens. And let me take you about, say, 12 years back. I had this girl who was a 17-year-old who came to me. She had a vision of just 1 meter vision without glasses. With glasses, her vision was absolutely normal. But can you guess the error that she had? She had a power of -18 in both her eyes. And she was 17-year-old. Her concern was that, doctor, I have absolutely low self-confidence. I find difficulty in doing activities like swimming, dancing, and I really can't maintain contact lenses. Can you give me a solution? This was 2004. Unfortunately, I had no solution for her at that time, for her error. And this actually made me start thinking about this problem. And I started going into research, I started looking into options available. And to my surprise, we are in a continent where you have highest number of myopes in the world. In fact, if you just look at this graph shows you the prevalence of myopia in 20-year-olds. And you see the 4 countries which are East Asian countries, the prevalence is almost 90%. So 90% of those 20-year-olds are actually myopes. In India, we don't have bigger studies, but the studies are coming in, and let me tell you, in last 1 decade, we have doubled the number of myopes that we had about a decade back. And what is the reason for all this? It's because of the lifestyle, and because of the culture of smartphones and tablets. The near vision activity has gone up. This is one of the hypotheses that it's causing increase in the myopia. Let me give you some figures. When we talk of myopia, you have high myopia ranging with the patients with power more than -5. The number in 2014 is really mind-boggling. It's 163 million people in the world who have this, constituting 2.7%. But what is even more surprising is, if you go to 2050, this is an estimated number that will actually happen. It's going to be 938 million, close to 1 billion people who will suffer from high myopia, not the standard 1 or 2 diopters, but people with more than -5 diopters. And they will constitute about 10% of the population. Why this is so important? Because myopia has issues, especially in Indian context. What are the issues? It's mainly social issues. In spite of so much of progress that we have had, still wearing glasses is considered as a social stigma in some segments of our country. I think everybody will agree that. One of the other things recently I actually discovered about the social aspect is from my own family friend, my own home friend, is the struggle which I have to actually undergo every day to convince my 9-year-old daughter to wear glasses. She has to wear glasses, but she refuses to do that. Maybe there are reasons which I don't understand. Maybe she gets fear of walking off, or there is a peer pressure. So there is social issue associated with wearing glasses. There are occupational issues. I don't know how many of you know that the nationalized banks or public sector undertakings don't take people who have more than 4 diopters of power, which is surprising. In a country of ours, this is a norm. You cannot enter into those things. So there is an issue. So what are the options now available with us? These patients tend to have spectacles. You can see the weight of the spectacles. Is it wearable? This is a big issue. Now, higher the power, the size of the image that forms on the retina is actually minified. So what they see is a minified version of the object. Why? How do you deal? I mean, how do you find it out? Is when they actually undergo a corrective surgery. The first thing that they tell you is, "Doctor, I see everything very big." Is because they were naturally taught. I mean, their brain thought that this is the normal size of the individual. So there is an image magnification, and they have a restricted field of vision. By restricted field of vision, what I mean is they can see only straight. If they want to see on the right side, they have to move the head like this. On the left side, they have to move the head on the left side. It's because the field of vision is very restricted because of the thickness of glasses. All these three things you can tackle with contact lenses. The contact lenses will not give rise to image magnification. The weight is not there, but there is a problem with contact lenses. They have recurrent costs, they have risk of infection, they have maintenance issues. So, LASIK, as we all know, has been there from 1991. But LASIK is not a full-blown solution because it does not correct more than diagonals. And it cannot treat for patients who have thinner corneas. Cornea is the black portion of the eye that you see. In Indian population, unfortunately, we have thinner corneas compared to our Western counterparts. Here also we are kind of lacking in that regard. And the most important part about LASIK is it's a structure altering procedure. So once you do the procedure, it's irreversible. So you have to live with its plus effects as well as some of the minus effects. Though it's not very common, but a higher degree of error, if you do LASIK, sometimes you can end up having phenomena like this. What you see is a starburst on the top left, and what you see here is called as halos. These times sometimes can happen. So the quest was on to look for a solution which is kind of corrects powers up to -20, -25, it's reversible, does not alter eye structure, and has no long-term side effects. And researchers were looking at putting something like in the eye, which was like a contact lens, but does not have any issues of maintenance or recurrent cost. So there were two ways of putting it. Either you put it here, or you put it just behind the iris. So the first generation of this was called as phakic implants. So phakic implants were the first generation of phakic implants were these. These are NTS chamber lenses where you are putting it in front of the iris. You can actually see the implants once you put the torchlight on the patient's eye. But they soon fell out of favor because they had some complication issues. The cornea used to become white over a period of time, so they were abandoned. But it was the year 1997 when the first posterior chamber implants actually came in, and that changed the whole scenario. The first studies started in 1997, and over a period of 8 years, extensive evaluation was done. US FDA realized the benefit of this lens and actually approved it for general use. So from 2005 onwards, this has been approved by US FDA and it's been used world over. So what is it actually? This is basically a posterior chamber lens, and what you see is a implantable colamer lens. It just sits behind the iris in front of the natural lens. What you see behind is the natural lens, and it is present in the space between the two. And this is made up of 100% biocompatible material, and it can correct up to 18 diopters of refractive error, starting from -0.5. It can also collect what is called as astigmatism. I hope everybody knows that there are two components of power. One is a spherical power, the other is a cylindrical power. So it can correct even a cylindrical error up to 6 diopters. The eligibility is usually patients between 21 to 45 years, stable power, and there is no other issue. Just share with you a very small video as to how it is actually being done. So if you see, it comes in a bottle filled with the fluid, and you can see that lens. Can you make out the lens? It's so thin that you cannot handle it with simple forceps. You have to use a cotton tip applicator to actually remove it. Can you see the lens? Now it is placed on a cartilage, and it's so malleable that you can actually fold it into the cartilage. So this is the cartilage, and then you pull it out from the opposite end with the help of a specially designed forceps. Every movement is so delicate because the lens is extremely thin. Any rough movement actually can cause tearing off of the lens. And then it is loaded on an injector like this, and the same cotton tip applicator becomes the piston of the injector. So now the lens is all set to be loaded, and here you can see the lens as I am pushing the injector, and this is a patient's eye actually. This surgery is done without any injection. There is absolutely painless procedure, and what happens is you just push it in the eye. And you can see how gently the lens goes in the eye. It goes in a folded format, and as soon as it enters the eye, it will just unfold. Can you see that? It's a totally folded lens, and as soon as it is entering, it is just kind of unfolding. And it is so beautiful that actually when it is happening, you are talking to the patient actually speaks that yes, I can make out that the lens is coming in my eye. So this is how it goes in, and then it just gets set. You need to do 1 or 2 small manipulations, and believe me, this is a 5-minute procedure. A lot of people think that it's a surgery, what happens, but it's over, the surgery is done. So this is what happens in the post-op period. The patient starts reading from 4th day onwards, and the total recovery is in 2 weeks. Follow-ups, you need about a couple of 3 to 4 follow-ups. And this is what happens, this is how it looks on the slit lamp. This is not a torchlight, this is a magnifying instrument through which we examine. If you see those brown pigmented lines, those are the lens that we had implanted. If you see the dark shadow, that is the distance between the natural lens and the ICL that we have implanted. And this is very important. If it is going to go very close to the natural lens, it can cause what is called as cataract. It can cause complications in the lens. We don't want that. So this is what we are assessing in the early post-op period. And you can actually measure it with the help of special instruments. And you can actually measure it. The ideal distance should be 250 to 750 microns. And if it is too low, believe me, it's reversible. I was talking about reversibility. This is how it can be actually reversed. You can actually use the same place where we had inserted, go in, just pull the lens out, and place another lens, or just whatever you want to do. The lens is out. So you can place another lens then. And this procedure can have glares and halos in the post-op period. Again, it's temporary, it settles down. Small risk of cataract is there, about 2% chance of cataract formation is there, but because of the close post-operative assessments that we can do now, we can prevent it by either doing the exchange, the removal of the lens, or we can just keep them under follow-up. And we can still lead. So what is the current state of this thing? You'll be happy to know almost close to 500,000 procedures have already been done in the world. And 10% patients have actually shown improvement in their vision from what it was before the procedure. Because you are giving a very natural solution to the patient. The lens is actually in the point where patient needs it. And the patient satisfaction is almost more than 88%. This is the same patient whom I had shown the 2004 I had seen. Actually, this patient underwent the procedure in 2014, both the eyes, and this is how she gave me a feedback as to what happened to her. This is after 1 year post-procedure, and according to her feedback, she is absolutely thrilled with the experiences, and she does tell us that her confidence is all back. So what Internet Explorer has done to our personal computers, the impact that Internet Explorer has done to our personal computers, or for that matter, iPhone has done, the way the phones have been made after iPhone. Similarly, LASIK to start with, then implantable column lens, has really done a life-changing impact on these refractive patients who have a high refractive error. And this is nothing short of a revolution, to be very frank. The point I brought this out because not many people know this, but this is something which is available and it is absolutely safe procedure, and world over they are doing it. And thank you for your attention.